let's step back for a second, shall we? Let's stop looking at OCD the way DSM tells us, insists we look at it, that it's nothing but a mere collection of obsessive thoughts that originate from nowhere and compulsive behaviors that originate from nowhere. Let's stop that. Let's take a more evolutionary approach to why does an individual even become obsessive? So certainly there's biological underpinnings, and some folks are just more prone to ruminating about things. But obsessive thoughts are very often a reaction to undealt with or poorly dealt with anxieties and conflicts from childhood or adolescence. So one way to look at obsessive and compulsive thoughts and behaviors is to look at it as maladaptive adaptations. So they are adaptations, but they're maladaptive. They're not in the person's best interest, but they started for a good reason. They started in order to protect the organism, the individual, from deep anxiety, deep concerns. We also should take one other step, is to think about circuits involved in the brain that lead to the presence of obsessive thoughts and compulsive behaviors. What could be better than psychedelics, if you really think about it, in interrupting and disrupting these maladaptive circuits? We know this for a fact, don't we, that appropriately dosed, say, for example, psilocybin, that's where we have the most data in obsessive compulsive disorder, is a genuine defragmentation of the typical patterns that the brain uses, the typical circuits a brain uses like a groove to go around the same path that is not working out for the person. It defrags it completely and offers a new opportunity for the brain and therefore the person to rethink their relationship with their anxieties and their fears. And can that lead to reduction in obsessive compulsive thinking? The answer is yes. The answer is yes, with at least 2 psychedelic treatment approaches so far. One is psilocybin. The other one actually is ketamine. And there's increasingly good evidence that ketamine therapy is not just one time, but offered repeatedly in combination with ketamine-assisted psychotherapy, genuinely can interrupt OCD-type thinking and behavior, even in individuals who have failed classic treatments such as SSRIs and SNRIs.